If you only have original Medicare, that is Parts A and B, you risk losing thousands of dollars in healthcare expenses. Luckily, during the Medicare Annual Enrollment Period, you have a chance to augment your Medicare coverage through Medicare Advantage and Part D plans. In this interview, I'll talk with Brian Crames, a licensed Medicare producer at QuoteManage, and together we'll discuss what is the Medicare Annual Enrollment Period and how it differs from similar periods. We'll also touch on the financial risks of only having original Medicare, your options to augment existing coverage, how to review your existing Medicare coverage, and some of the additional benefits that are coming to Medicare Advantage plans this year. Hi folks, Ryan Malloy here, Managing Editor at Senior List, and today I'll be talking with Brian Crames, a licensed Medicare producer at QuoteManage, a Medicare brokerage insurer. So to start things off, Brian, can you tell me, what exactly is the Medicare Annual Enrollment Period?
It's Ryan, it's an open enrollment period that starts on October 15th and goes through December 7th. And that's basically a chance for people to take a look at their Medicare situation. If there's any changes that have been made, especially with the Medicare Advantage plans, they'll get those changes on October 1st. And that's when they'll need to understand if a doctor left the network, a prescription is no longer in the formulary. Maybe they just don't like the quality of their medical care. They can look at options, and that's what we're doing.
So it's essentially a time to look at what your Medicare options are and maybe reassess what might be a better option for you.
Exactly.
And what's the difference between Medicare open enrollment and annual enrollment? There's a few different enrollment periods, yeah?
Absolutely. The Medicare annual enrollment is from October 15th to December 7th. That's when people make any changes they want to. They can add coverage, they can drop coverage, they can change plans. The open enrollment period is from January 1st through March 31st, and that's when people can make one change only from one Medicare Advantage plan to another, or go back to original Medicare with a prescription drug plan. So they can only do it once, one time.
And so with regard to annual enrollment, if you were to do nothing during this time, what happens and what might you be risking?
Well, with annual enrollment, again, for people, this is mainly geared towards people with Medicare Advantage. If they see that there's no changes in their plan that's significant, get those changes on October 1st, right around the corner, then they don't do anything at all. But if they don't take a look at that paperwork and realize maybe their doctor left network, or their copays changed, or their benefits changed, they could be possibly paying a lot more money next year for their medical care, maybe not being able to save money as well.
And so this kind of ties into my next question. If I already have original Medicare, both parts A and B, why should I consider additional coverage?
That's a great question, Ryan. There's a couple of risk factors involved. The smaller types of medical care is not going to be an issue for a lot of people in the Medicare system. It's the big catastrophic ones that are very damaging financially. They have to go to a hospital and all they have is original Medicare. Currently, right now, Medicare can charge them $1,484 just to be admitted. That doesn't include the surgeries, the labs, the x-rays, and the MRIs, and so forth. That falls under Part B, and that's that 20% that Medicare does not cover. And that could be a large amount of money. That could be into the tens of thousands of dollars. So that's why they need to look at protecting themselves against that risk.
And yet, to my understanding, original Medicare does not have any maximum out-of-pocket limit, correct?
Correct. That could go on and on. That could be there. They could literally have tens of thousands of dollars at risk to them just being on the original Medicare.
So if I'm someone who's looking to maybe augment my existing original Medicare coverage, what are my options?
Well, if they only have original Medicare, nothing else, then what you need to look at is you got a couple options that you can kind of peruse during the annual enrollment period. Either A, look at what's called a Medicare Advantage plan, or B, look at what's called a Medicare Supplement plan. Those two options, depending on their situations, those will both protect against those catastrophic
costs. Okay. And what about Medicare Part D? Where does that play into all of this?
Medicare Part D can be attached to what's called a Medicare Advantage plan, so they can kind of wrap everything up in one plan, or they can pick up what's called a Medicare Supplement plan and then have a private Part D prescription drug plans that's separate. Either way, they'd still be protected from having to pay large amounts of money and possibly very high copays or out-of-pocket costs without having a Part D plan.
So How exactly are Medicare Advantage and Part D plans? How are they different than Medicare Supplemental Insurance?
Medicare Advantage will tie, in most cases, it'll tie the Part D prescription drug coverage together with the plan. Whereas if you have a separate Part D plan with a Medicare supplement, you're paying an extra premium for that Medicare Part D. So you're going to have two separate premiums, one for your supplement and the other one for your prescription.
I see. And so to bring it back to the annual enrollment period, let's say I just got my annual notice of change. It's October 1st. What are some things I should look out for? Maybe some reasons I might want to consider changing plans.
That's a great question. There's a lot of reasons, but the primary ones are going to be, are my doctors still in network? Did my physician, primary care physician, did my specialist leave the network? That's one reason my people might want to look at other plans. Another main reason is prescriptions are no longer covered in the formulary. If that's the case, they could possibly look at another plan to see if that prescription is covered in their formulary. The other two main reasons is have my copays gone up? And that annual notice of change will let you know, okay, it's increased here, it's increased there. I need to look at that's quite a bit of a change. I need to look at another option. And then finally, have I lost benefits? Sometimes the dental, they may have a dental benefit that's decreased. They may have a vision benefits that's decreased. I don't like that. I use that a lot. Let me go ahead and look at another.
Would you say it's common for doctors to fall in and out of networks every year?
It's not common, but it does happen. And if the doctor's no longer going to be accepting that particular plan's insurance, then that usually starts on January 1st. And they'll send out that, like you said, the annual notice of change October, and your doctor's no longer in network. And then that obviously enlightens people, hey, I need to look into changing to a different plan.
Gotcha. So we want to pay attention to doctors, network coverage, prescriptions, and then maybe any benefit increases or decreases.
Correct. Benefits decrease. They'll let them know that as well. The miscellaneous benefits, and some people, that can make or break whether they want to stay with. And I'm going to look at a plan option that can have those increased benefits.
So we won't know this until later in this year, but what are some additional benefits that are coming to Medicare Advantage plans this year?
A lot of these plans are doing a lot of increased benefits, more dental, more vision. Some offer transportation for medical trips to and from doctors and specialists and so forth. Some of these plans offer what they call over-the-counter benefits. They may increase those, where the plan will pay for items that you normally purchase at a drugstore, and they'll give an allotment either monthly or quarterly for that. So some plans actually offer meals for people that just recovered at a hospital,
Oh, wow.
inpatient hospital stay, where they'll deliver meals delivered to their doorstep to help them improve their health, because people, they're recovering, they may be weak and don't want to cook or anything like that. They don't have anybody to help them out. So there's different options out there that can definitely help.
So when you're looking to re-examine your Medicare coverage, there's kind of some special circumstances for people. What would you recommend, say, veterans?
Well, the veterans, again, I definitely appreciate their military service. Absolutely. A lot of times they say, I use the VA, and that's fantastic. However, the VA, as we all know, it's more of a limited network. They don't have the broader variety of networks. So Medicare Advantage plan is like a secondary, a backup type situation, if you would, where they can look at, hey, the VA is closed on Saturday, I need urgent care. They can look at their Medicare Advantage plan as an option there. Some of these plans out there actually contour to veterans. What I mean by that is they have richer and stronger benefits, and some of them don't have prescription drug coverage because they're veterans using the VA for their prescription.
Okay, so it sounds like veterans are able to kind of make the best of both VA coverage and Medicare Advantage coverage.
Correct. That's what the term is called, double dipping. If it's like a slang term that they can use the VA or they can use their Medicare Advantage plan, but they have a backup because, like I said, the VA's great for a lot of circumstances, but it doesn't have that broad network. And like I said, urgent care is a big one on Saturdays and Sundays. If somebody needs care right away, they can go into an urgent care center with them.
All right. And so what about, let's say I'm still working. What should I consider when it comes to annual enrollment?
Working gives you a few options. If you're working and you still have your Part B, you have group coverage, all you need to find out from your human resource department is my group coverage equal to or better than Part B. If that's the case, you don't need to be enrolled in the Part B. If you don't have Part B and you're working, You can take a look at the Medicare Advantage options for annual enrollment period. A lot of the group plans, their open enrollment kind of coincides with the annual enrollment. So October, November, we can disenroll from the plan. You want to really weigh out those options still working and see if it's advantageous to you to stay with your group plan through your employer or look at a Medicare Advantage.
Gotcha. And are there any other special kind of circumstances you can think of?
Well, some people receive help for prescription drugs from Social Security. It's called
Ah,
extra help terminology. It's called low income subsidy, and there's different levels based upon income and resources. However, if you do get that extra help, you're able to look at options on different Medicare Advantage and prescription drug plans every quarter, every 3 months. And so that's a huge benefit. That's called a special enrollment period. If people want to make changes, again, maybe doctors left network, prescriptions no longer in the formulary, they're not happy with their benefits, they can look at different options once every quarter.
and so obviously, I'm sure anyone watching can tell that all of this coverage information can get a little bit complicated. So,
Absolutely.
yeah. So could you tie that into the work you do at QuoteManage?
Well, again, some people, again, just talking about the low income subsidy, that's going to not only reduce their co-payments, but we kind of explain their options to them based upon their circumstances. So whatever they have, we kind of ask a few questions to find out their situation and see if we can either A, increase benefits, B, offer you additional benefits you currently don't have that can help you, or C, possibly lower your co-payments and help you save money. That's what we do at QuoteManage, is to maximize their benefits and minimize their co-payments. They are paying co-payments, put more money back in their wallet.
Okay, great. Well, that wraps it up on my end, Brian. Well, thank you so much for joining me. It was a pleasure as always.
Thank you. Appreciate it. Thank you very much, Ryan.